Thank you for coming today. Utah communities are dealing with a frightening public health crisis, the fact that the rate of suicide in our country is increasing. Utah has the 6th highest overall rate for suicide in the country, according to the Center for Disease Control. Young people are especially at risk, a cruel circumstance since they are the hope and promise for the future of our communities. Suicide is the 2nd leading cause of death overall among those aged 15 to 24. When a young person causes suicide, it causes heartbreak for family and friends and devastates an entire community. They're left to wonder what, if anything, could have been done to prevent it. We can and we should do more to understand what puts a young person at risk of tragically ending their life. This is a multifaceted challenge, and it will take work from numerous perspectives, and that's what we came together today to do in a roundtable with people from state government, from the private sector, from our communities, from our schools, to talk about what we might do to prevent future deaths by suicide. We know that in Utah we need more mental health treatment counselors and providers for individuals in crisis. I've worked for more funding for our current mental health professionals, such as those who staff the suicide prevention crisis line and those who assist law enforcement and others with the response to mental health emergencies. And today I'm coming at this challenge from yet another perspective. I've introduced an important piece of legislation with the goal of understanding why the rate of Americans dying by suicide is on the rise. Why, after a stable period from the year of 2000 to 2007, why did suicide rates for children and teens and young adults increase from 6.8 deaths per 1,000 to 10.6 deaths per 100,000? My legislation directs the National Science Foundation to award grants to colleges and universities and nonprofits to support research about what leads to suicide attempts. It could be social and economic factors, technology or stigma associated with mental health conditions, or a combination of things, even genetic factors or geographic factors that also are correlated with a risk of death by suicide. And despite progress in mental health and behavioral health research, current gaps exist in our scientific understanding of mental health, the human brain, and effective care and treatment. We need to fill in those gaps in order to address this crisis and ultimately to find the solutions that will save lives.